Hi everyone, this is Dr. Bill with Easy to Pass NCLEX, easytopassnclex.com. Today we're going to be talking about sepsis, okay? So what is sepsis? Sepsis is mainly dysregulated response to infection. When the body gets infected with any microorganism, that's the response the body gives, right? So sepsis mainly means that the body is responding to the microorganisms that are being left untreated. This can lead to septic shock and can lead to complications such as organ failure or multi-system organ involvement that can lead to organ failure. So what are some causes of sepsis? It can be bacteria, some of those microorganisms. It can also be virus. It could be fungus. Usually the main causes are bacteria, but it can be other organisms as well. Okay, so what are signs and symptoms that you'd be looking out for a client who may be experiencing sepsis? So they're going to have hypotension, decreased blood pressure. So the systolic blood pressure will be persistently less than 90. We may also be seeing this because of vasodilation from chemicals such as cytokines or cytokines, however you may say it. But notice that hypotension is a classic sign of sepsis. You can also have tachycardia. Basically, the heart is beating faster. The heart is beating faster to compensate for the lack thereof of perfusion or the low blood pressure. What would that pulse feel like? It will be very weak and thready. Okay, even though it's tachycardia for compensation, it's very weak and thready. The patient may have also increased respiration. The respiratory rate will be increased as a compensatory mechanism. Temperature. In response to infection, they may be warm or have increased temperature and also increased carbon monoxide. So those are some early signs that you may see. Some of the late signs of sepsis that may occur would be Oliguria, mainly low urine output. And this is in response to the organs maybe potentially shutting down to absorb or hold on to the little fluids that I have that are left. Okay, the patient may be cold and can also go into coma as a late sign. So that is why sepsis needs to be addressed, treated, and have a quick response so the client can have better outcomes. So now that we've discussed all those outcomes for signs and symptoms, or now that we know what the signs and symptoms are, what are priority nursing interventions? And these are really important. Okay, so you want to hydrate the client. Mainly, we want to increase perfusion. We want to increase perfusion by hydrating the client. Give them a lot of fluids. Okay, give them fluids. And in some instances, they may need some vasoconstrictors if they're not responding to the fluid. So an example is norepinephrine. What does that do? It constricts the blood vessels and tend to increase the blood pressure, and also may increase or should increase the mean arterial pressure, which is the MAP, to be greater than 65. Okay. Other interventions include oxygenation. Oxygenate the client, give them oxygen. Also, you want to make sure that the client is having decreased inflammation. So in this case, low dose steroids or glucose steroids can be given to the client to help decrease their inflammation. Notice that infection by itself may increase blood sugar. And now that we're giving the client some steroids to reduce inflammation, we want to look out for increased blood glucose, which is hyperglycemia. So the client may be getting blood insulin to lower the blood glucose level at the same time while we tending to reduce inflammation. Okay, and then the other classic treatment is broad spectrum antibiotics. But before you initiate that, you want to anticipate drawing blood cultures before you start the antibiotics treatment. Also, do not delay antibiotics because of cultures that have not been obtained. Okay, and then reassess the client's temperature, vital signs to assess that they are responding to the treatment. So that is how to manage sepsis in a nutshell. Let us know if you have any questions. Dr. Bill with Easy to Pass NCLEX. Thank you.